Our military men and women are facing more than just enemy fire during their service. A new report released by the Pentagon shows specific service members have a higher risk of developing cancer. Queen City News reporter Daniel Pierce is live in Charlotte tonight. And Daniel, you've been getting just a glimpse of how this is impacting local veterans.
Yeah, one doctor told me that he is hoping that this new report will allow service members to open up more with their physicians in those health screenings. Something that may have seemed routine that they were exposed to overseas may have a lasting impact on their health. And while doctors say that this is a good tool, one told me that the infrastructure to even care for the cancer diagnoses already is simply not there.
It's a gift that will help veterans self-identify that they've had an exposure.
In a new report by the Pentagon, researchers found air and ground crews are more likely to develop certain cancers. Air crews are at an 87% higher chance of developing melanoma than the general public and have a 39% higher chance to develop thyroid cancer. Ground crews have a 9% greater chance for melanoma and 15% higher chance for thyroid.
So for the pilots, it's because of the decreased protection of the ozone layer as you're at altitude. For the ground crews, the toxic exposures are many. All of the aviation fuels, the hydrocarbons, those have an effect. And then any exposure to any radiation as far as the munitions and such.
Dr. Randall Gale has worked with Veterans Affairs in Salisbury for more than a decade. He says the report could lead to better treatment early on.
A veteran who might not have thought about it when I ask him those questions about toxic exposures will now say, well, now that you mention it, yeah, I saw that report.
It also comes at a time when the veteran healthcare system is dealing with a need on three fronts: cancer development increase in veterans who served in Vietnam, exposed while on base Camp Lejeune, and those exposed to burn pits in the Gulf War. The resources to treat all of these aren't easy to come by or get to.
We do have infusion centers, but we're giving limited chemo. So a fair amount of our chemo at the far sites is sent out because it's not comfortable to travel when you're undergoing chemotherapy.
Dr. Gale said that whenever we are talking about cancer, one thing that he is seeing more of is breast cancer in female service members. This Pentagon report, it does say that while there is an increase in cancer diagnosis in these service members, there is not an increase in death from those cancers. Live in West Charlotte, Daniel Pierce, Queen City News.